On the News Channel 5 network, this is MorningLine.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris coming to you on a Wednesday. Good show on tap with some breaking news actually associated with the topic this morning. You know, every month we talk medical malpractice and we take your phone calls. If you have questions or comments about whether or not you feel that you've been wronged by a doctor or a hospital and you're wondering if maybe you have a case. Well, we've been talking about it with our guest who I'm about to introduce to you for several years now. And basically what he's been saying all along is now proof positive in a report that now is making national headlines. We're going to talk a bit about that, and then we're going to put the phone number up and take your phone calls and comments. But let's just get right into it with a local malpractice attorney, well-known attorney, and a good all-around guy, Clint Kelly. Good morning to you, sir. And this morning when I talked to you on the phone, you were, I think, I don't know if the right word is excited, but you were very, very taken by this report, which was on the CBS Evening News last night. They've been talking about it on NPR this morning. I think it's gone national.
Yeah, this is, and I was animated this morning because you and I have been doing this show now for 2 years.
Okay.
We've been talking about all kinds of statistics and reasons why there's medical negligence going on in hospitals across the state and particularly across the country. This study, which came out from Johns Hopkins, it's hot off the press, was, as you said, reported last night, concludes that medical errors are now the third leading cause of death in the United States behind heart attack and cancer. And to put it in perspective, and we'll go through this report in more detail through the show, but this is the chart of the causes of death ranked from the bottom to the top.
If you would, okay, they can't, okay, hold that up.
All right.
What are the ones after? Because I'm thinking heart attack and cancer are always at the top of most of these lists.
Right.
If we can get the monitor up here too, I can see it. That monitor's not up. The one over there is.
He's got it right now.
And Rick's got it up there.
Right.
Okay, you can see. So what are the ones underneath? The red is obviously medical malpractice or hospital errors, right?
red is the error there that you see there. To put that in perspective, that's 250,000 deaths a year.
Okay.
Which is twice as many as auto wrecks, which is under that 136,000 a year, and it is almost half of the amount of soldiers we lost in the United States Civil War. So that gives some perspective as to how many people are dying. It's kind of scary also that over 600,000 people are dying from heart attack. But that gives you some idea now of how important preventing medical errors is in this country, because you think 250,000 people are dying each year from this. Something has to be done.
What are some of the ones, I'm just curious, you can put it down now, what are the ones underneath that it tops?
All right, well,
it's more deaths
twice as many as auto accidents.
That's amazing.
A little over twice as many as strokes, about 3 times as many as Alzheimer's and diabetes. Influenza takes 66,000 deaths a year. Suicide takes 42,000. That's way too many as well.
Yeah, of course. But all of those, it trumps it. The only two that have more are cancer and heart disease. So what does this mean, the big picture? I mean, okay, we know this. You've been saying it all along. I didn't realize it was to this scope.
A lot of us did. And as I told you off air, 20 years ago, there was an article that was put out called The Error is Human, published in the Journal of the Medical Association, which concluded that approximately 98,000 people were dying per year, about as many people per day as fly a jumbo jet. That study was, it did not get the traction that a lot of people in the medical community and those of us in the legal community who do this type of work thought it should get. And so these physicians at Johns Hopkins went back over the last 6 years and looked at the statistics and basically compared it with what was in the article To Err is Human. And the death rate was so much higher than what it had been in that previous study. And what they also concluded, and we'll go through this in greater detail, is none of the things that were suggested into Err is Human have been applied to reduce the death rate. We have systemic errors in hospitals. You and I talk about this.
Sure.
We preach about this all the time, about the things that are not done in hospitals, things that aren't reported, corrective actions that aren't taken to prevent deaths. And as a result, we have medical mistakes, medical malpractice, killing people regularly on a daily basis across this state and across this country, and I don't see any end in sight.
Okay, and again, if you're just joining us and you haven't seen Clint and I on the program on MorningLine before, again, he's a malpractice attorney, and we've highlighted plenty of cases. We want to be clear here. These are not cases where, I guess you've seen some where it's just blatant malpractice and what's the word for it, where they've really gone overboard. But we're not talking about killers working in hospitals, blatantly killing people and committing murder. What we're talking about are egregious errors or lack of proper protocol that are resulting in really negative results.
Right, and there's something that gets lost in this is there are 250,000 people who die each year from preventable medical errors. That number does not include those who are seriously injured each year as a result of medical errors. This number they predict is probably tripled or quadrupled when you take into account the number of people who sustain some type of injury as a result of a medical mistake. My read of this article is that we are dealing with a healthcare system that's basically a sloppy system in which human beings are involved, and there are going to be errors. And as I've told you many times here, as the volume of patients increases and the healthcare ability to take in those patients and provide care is trimmed down to be more efficient and more profit-oriented, you're going to have more and more people getting injured or killed. And as you said, it's not because somebody intends to do it, it's simply a matter of statistics that if you don't have any margin of error, one mistake can be enough to kill somebody.
But here's the problem with it, Clint, and you've said that there are hospitals, some that you would stay away from, and there's others, but you would acknowledge that all hospitals, no matter how good, have some of these issues. Here's the thing, short of having attorneys like yourself and litigation to hold hospitals accountable, you can have reports like this come out, and you hope that gets their attention. But if I get sick, I have no choice but to go to a hospital if it's to that level. Most of it, it's like a monopoly. I mean, you have to go to a hospital, and you think that maybe a study like this will get hospitals to take notice and maybe do a better job of correcting these problems. The cynical side of me is, you know what? Why change? Okay, so that report comes out. The only thing that's going to get someone's attention to straighten things out is the bottom line and getting their butt kicked in court.
That or some type of regulation that...
If the federal regulation comes in, but then how are you going to pay for what they're requiring?
That's true. I think that the key is more transparency. If you're able to get more accountability in the way that these statistics are reported on an annual basis, I think hospitals ought to be compelled to report how many errors they have on an annual basis. I mean, doctors have to report when they've settled cases or when they've had judgments against them. Why aren't hospitals held to the same standard so consumers can make an informed choice of one hospital versus another?
Exactly. It should be kind of like the restaurant report. You know, you go in, you see the yellow form there from the restaurant inspectors and a 100's a perfect score. I walk into a place and I see a 50 on the wall. I'm out of there. I'm not eating there. I don't know why. And, you know, what I eat for lunch is not as important as the hospital I go to for some type of surgery where they're going to cut me open. And yet I can't tell unless I would call you if I knew, because I know you know. But I mean, I don't know if this hospital, what hospitals have reputations that others don't, or what's the safest hospital to go to. I don't know.
I mean, I truly believe that.
How can someone find that out?
Well, you can't. That's just it. These types of statistics aren't reported by the hospitals. It's not in their financial interest to report it to the patients or prospective consumers. And so you're left in the dark unless you know somebody like me or those of us who do this type of work, what hospitals have a good reputation in providing care and ones that have a poor reputation in providing good care. And you talked about what can I do as a patient because there's a monopoly. We've talked about this in many shows. It is having a family member or a so-called patient advocate come with you to the hospital and make sure everything is being done that's supposed to be done, questioning nurses, questioning doctors.
You have to question, because the thing is, I won't know. If I go with my wife and she has a procedure, I mean, I don't know what she really needs. I guess I can observe it, but do I really know if a procedure is or isn't being done that should be? I mean, I don't know. When you say, how does the patient know if it's being done right?
The patient doesn't. The patient is extremely vulnerable.
Okay, but me as the spouse, how do I know?
You just have to ask.
Okay, so ask. Is this the right thing? Or is that the right...
I mean, I've been in the hospital when my grandmother had surgery years ago. I was in the hospital, and the nurse would come in there and take the vital signs. They'd bring her syringe in there, and you just ask them what's she getting an injection for, because she was out of it. And, nurse will sit there, and they don't have to take any offense to it. They'll sit there and tell you what it is. Now, if they're coming in there with, a big shot of morphine and she's already out, you ask yourself, why is she getting more pain medication? Or if the nurse looks on the syringe and goes, oh my God, and walks out because she got the wrong medication, which this study concludes is a major problem in causing medical errors, yes. Then just by asking that question, you may have prevented a loved one from getting the wrong injection that could have killed her. So you just simply have to take the time to ask questions to help the healthcare providers make sure that they're doing what they're supposed to be doing.
And maybe your questions that you ask help them prevent making an honest mistake.
You sure hope so.
I'll tell you what, though, from the time we're small, be it a doctor or a law enforcement officer, we are taught the respect and to trust them as being professionals, to look out for their best care. And when you go to the hospital sometimes, a good friend of mine, went into the hospital one time. He was going to have open heart surgery. Doctor comes in and goes, hey, do you have any questions for me? And he looked at him and he said, done this before, Doc? He goes, yeah. I'm not a doctor. You know what you're doing? Yeah. Just do it. I don't want to know. Because he just trusted him. Well, and that's the attitude. You just figure, well, the doctor, they've got all the schooling. They're the experts. Who am I to ask questions? I mean, that's the thinking that we have to break out of.
We do, but it is in our DNA.
It is. It just is to trust.
I would say the better way to look at it is trust, but question.
Sure. Oh, yeah.
Trust, but question.
Always
and
question authority.
Yeah, and that will probably prevent some mistakes.
You're right, and that's something you have to get to, and don't be afraid. And if they don't want to answer your questions, let them have it and walk out. Right. Of course, you may not have that option if you're very sick. But any doctor that doesn't want to answer your questions isn't a very good doctor. End of story. Look, we're going to take a break on that. When we come back, we've got the phone lines open. We've got some calls here. Again, we'll talk more about this study. If you want to ask anything with, pertaining to that, or you have a question or comment about a situation you're dealing with, that's really why Clint Kelly's here. We'll be back with more of your calls in our conversation on Malpractice right after this.